The two things that seem to be the hottest topics I want to address right now, first is the shelter-in-place order. Now, Dr. Byers is going to come, and he can correct me if I say something wrong here. But as I understand it, the number one issue for all of us, particularly me, is protecting the health of our citizens. This thing spreads by person-to-person contact, as I understand it. And that's the reason for the guidelines to remain 6 feet apart. That's the reason for no more than groups of 10. That's the reason for the shelter-in-place order. What we're trying to do is to avoid congregations of people. That's when it's going to spread the most. And a lot of people have called me and said, how do I abide by this shelter-in-place order? And there's a lot of different scenarios that are put out. For me, the best way to summarize it is avoid groups of people. That's a good rule of thumb. If you can engage in whatever activity you want to engage in and not come into close contact with people, then it's okay. But if engaging in a particular activity brings you into close contact with a lot of people, then you shouldn't do that. Now, I had a call today from a physician who made a very good point, something that I hadn't really thought of before. He pointed out that our normal life is still ongoing. In other words, people are still having heart attacks. People are still getting into car wrecks. People are still having chronic diseases. They're all coming to the normal everyday health care facilities and making the normal everyday health care demands. So what we've got now is something in addition to, not in place of, those demands. And the number one reason for the shelter-in-place order, the number one reason for avoiding contact with others, is so that our healthcare system does not get overwhelmed. We don't want to find ourselves in a situation where we've got more healthcare needs than we have supplies or people to take care of that. We've talked about ventilators, we've talked about ICU beds, how critical they are to treating people with COVID-19. As I understand it, today we don't have an unmet need. Today, as we stand here today, everybody who needs a ventilator has one, everybody who needs an ICU bed has one. We don't want to get into a situation where we have far too many people for the ventilators and the beds that we need. And that's why all of these procedures, these protocols are in place so that we don't get to that point. We don't exceed what we can provide. And when you make when he made the point today, when you consider all the other things that are happening with the heart attacks and the car wrecks and whatnot, it just drives home the point, I think, that we don't want to overwhelm our system. So please obey the orders, stay home if at all possible. Do not get out among crowds of people, and let's all take care of our citizens and our neighbors. This is what it's designed to do, is to help take care of our neighbors. We as Mississippians are great about that. We want to make sure we do that. Second thing I want to talk about is the unemployment claims. Last Friday, I had the opportunity to sit down with Jackie Turner, who's the executive director of the Department of Employment Security. They are the organization that's dealing with the unemployment claims. Their system, as you can well imagine, has been overwhelmed. They normally get about 600 calls a week. Last week, they got 6,000. So 10 times as many of the normal calls. They normally have about 250 phone lines. They've expanded it to 900. They normally receive calls from 8 to 5 every day. They've gone from 7 to 10 at night. They are training more people. They're trying to find more people. They're doing everything they can, I believe, to assist you with your unemployment claims. But the number one point that she made, and I will convey to you as well, is that people need to understand that their claims, or their benefits, I should say, start from the day they were separated from their employment. In other words, whatever day you lost your job, whatever day you were laid off, you will be paid from that day. A lot of people are operating under the impression that they've got to file the claim today to get the benefits started, and every day they wait, they're losing money. That is not the case. So if you're in a situation where you don't have to have the money today, you can wait, then that would help alleviate pressure off the system. Wait till next week to call. Wait till the week after to call. Call during non-peak hours, she suggested, which is after 5 p.m. at night. I know many of you are sitting at home, wanting to redeem the time, and so you think, well, I'll go ahead and file my unemployment claim. Well, if you don't have to do it today, it would certainly help alleviate the system and to wait to make those phone calls. So there are more benefits coming down with the CARES Act. Tomorrow, during my daily update. I'm going to devote the entire time to the CARES Act. My staff has worked very hard to try to understand the CARES Act, understand the employment benefits that are coming down under the CARES Act. I have a summary of that. In my daily updates on my Facebook page, I'm going to devote the entire time to discussing the terms of that CARES Act, and hopefully that'll help you understand your unemployment situation. There are a whole host of other things going on. I won't take up time addressing those. I know we have others to talk. I'm here to answer questions, be glad to try to help you. Let me give out my contact information. My office number is 601-359-3300. We have someone staffing that, manning that 24 hours a day. We've established an email address to receive your questions. That's COVID-19 questions@house.ms.gov. We're working very hard to get you the answers that you need. Please don't hesitate to contact us. Thank you. I guess I'll turn it over to Commissioner Gipson now. He's the next one here.
Thank you. Thank you, Mr. Speaker, and I do want to commend you and your staff for a great job keeping Mississippians informed. It's been helpful to me as well. And working alongside all of our state officials, it's a great team of people. Each one of us have an area of specialty, of expertise, and I'm here today to talk a little bit about not only the impact on agriculture, but also some issues that we see in grocery stores, and also some animal issues that have recently come to light. Before I do that, I want to commend Mayor Fisher and all the team here for setting up this testing station here in Clinton, Mississippi. Clinton's a great town, a great place, good people. I spent 4 years here as a student at Mississippi College and graduated, and I appreciate your involvement and your support of the community in this regard. Regarding grocery stations, our employees are still working. One of the things that we do at the Mississippi Department of Agriculture and Commerce, which is an essential function in agriculture, obviously, in food and commerce, petroleum products that we use to transport food products and every other aspect of commerce. But we do go into grocery stores and we maintain inspections for consumer safety, and also of every scale and scanner, we test those. And one of the things that we're getting reports of from grocery stores at this time is the people who are coming in bringing the whole family. And I want to say that's probably the worst idea you could have, is to take your entire family into a grocery store anywhere and try to get groceries right now. If at all possible, you have one person in your family designated to go into the store to be the front line, to get what you need. And by the way, do not hoard. We're still getting reports of people, especially over the weekend, hoarding. There's no need for that. All that hoarding does is drive up the cost for you and for everybody else. We have plenty of food in this country, in this state. We're blessed in that regard. It's a supply chain that's continually rolling. So those two things, one person at a time from your family. And if possible, when you go, ask your neighbor, ask your other family, extended family, is there anything you can get for them, so that we minimize the number of people coming into grocery stores here in Mississippi. And in doing so, we will minimize the spread of this terrible disease. The second thing I want to mention is the new issue of animal infection. There over the weekend was new virus. It is a new virus. It's a novel coronavirus. We've never seen it before. Up until this point, there was no confirmation in this country that it was spreading from people to animals. Now we do have that confirmation. So I would say to people, until we get a better handle on this, you might want to maintain social distancing with your pets as well. And, continue to feed them, care for them, but don't, you don't get up in their face if you can help it. And obviously, there are a lot of unknowns. We are working very closely with our partners at USDA, the Animal and Plant Health Information Service, and also our great Board of Animal Health, Dr. Jim Watson. I serve on that board as well. And as we have answers, we will make them available. The last thing I want to mention is we have established a resource for you, for Mississippians, on our website at mdac.ms.gov/COVID-19. And we're really emphasizing a few things. Of course, the items I've just mentioned. If you can stay at home, stay at home. Our farmers are still working. There's still plenty of food. But while you're home, why not start a garden? Why not get back to the soil and reconnect to the land? That's where what our country was built on. From the very early days, our Native American friends taught us to live off the land. Settlers who came did the same, and now we have that opportunity in this window of time that we're home to not only care for ourselves and exercise independence, but teach our young people how important it is to stay connected to the land. Thank you for being here. Thank you, City of Clinton. Thank you, Speaker. Thank you, Doctor. Appreciate you. Turn it over to you.
Hey, good afternoon, and I certainly appreciate the comments from the Commissioner and the Speaker, and thank the Mayor for this opportunity for us to be here. And, you know, when we think about one of the objectives that we're trying to do to prevent transmission of illness, identifying those individuals who may be infected is of utmost importance. And that's why we're glad to be able to partner with the city to be able to do a testing clinic at Traceway Park on Wednesday, and the hours of operation will be from 8 to 4. You know, for individuals who are interested in having that testing done, if you will download the C Spire Health app, and that information will be available on the website, as well as there's a number for those individuals to be able to call and speak with the University Medical Center so that they can be determined if testing is indicated based on their symptoms. If you think that you may have symptoms, we encourage you, if you're in the area, to download the app, to do that call, to see if you do need to be tested at that point. So, you know, when we think about testing, it doesn't end there. If you are an individual that's been identified that you may need testing, there's a potential that you have infection. So, you know, the recommendations are, while you're waiting for those test results, is to go ahead and isolate yourself. Isolate yourself from your family, isolate yourself from your pets. We want to reduce transmission in the household, and we know that, like the Speaker said, this is person-to-person transmission. Those individuals who are very close in the household, that's where the risk of transmission occurs. If you think you have this infection, if you're an individual that's been identified as needing testing, you'll be given some instructions at the testing site for isolation at home, staying away from your family. Don't get tested and then, while you're sick, go to work or go to the grocery store or do some of the other activities that you would normally do that you would think of as essential during your daily life. Stay home if you've been tested. I can't stress that enough. And, you know, when you think about globally what we're trying to do, is we know that for most individuals who are infected, they either have relatively mild symptoms or they recover without any long-term problems. But we do know that there's a part of our population that are at higher risk for complications, from being hospitalized and unfortunately from deaths. And when we protect ourselves from getting infected, when we practice social distancing, and social distancing is not always just, you know, not being in a group of 10. If you're in a group of 4, still keep 6 feet away from each other, you know, because that's how transmission can occur. But the more we do to protect ourselves, the more we have protection for those people who are most vulnerable in our population. We can, if we don't get infected, we're not going to infect those people at higher risk. So it's important to identify those people who are infected. You know, we have a plan at the Department of Health where we investigate every one of those cases. We identify those close contacts. We put them in isolation. We put their contacts in quarantine until we can assure that they're not going to become infected and potentially spread it to others. And so these are all important things that we all need to do, but we all have a role to play. We all have a part in this, and this is really, you know, fleshing out to be the pandemic of our generation. And for us to flatten out that curve, The more people that we identify as infected, the more people we get isolated, the more contact tracing we do, the more social distancing that we do. These are all components of protecting our most vital population, keeping our ICU beds available, because as the speaker said, we still have normal stuff that occurs. We still have people who need to access and utilize the hospitals as they would have normally done anyway. And so we need to preserve our healthcare capacity. And these are all tools in our toolbox to be able to achieve these goals. We're not through this yet. We still have a bit of time where we're going to continue to see cases. If you're keeping up with the data that we're reporting, we have over 1,700 cases in Mississippi reported, and we have over 50 deaths. And we want to keep those numbers down. And by all of us doing our part, we can do that. Thanks, y'all.
I've got a couple of questions.
Yes, sir.
I can answer. Are animals being tested before people?
No, I'm not aware of animals being tested before people, but it's important if you are infected, if you are sick, and I think the commissioner said this, is don't be the primary caregiver for that pet or that animal in your family. Keep some distance. We don't know that our pets at home can transmit it back to us or to other people, but we know that they may become infected, and we want to avoid that if we can.
Another question, this asks if cooks working in grocery stores, we're getting a lot of questions from outside of Clinton. We've got from the Delta, from North Mississippi, from the coast, so a lot of people are watching this. Are cooks supposed to wear masks while they cook?
Well, one of the things that, and the cooking in general is not a higher risk than just being there yourself. But one of the things that we want to encourage everyone, even if you're working within an essential business, is to make sure that you are practicing social distancing, that you're doing those things that we've been talking about the whole time. Don't come to work sick. A lot of us like to muscle through and say, it's just a little bit of a cough, it's not much of a fever. If you're sick, don't come to work, period. Wash your hands and have hand sanitizer available. Make sure that you're cleaning your environmental surfaces around you at any of the essential businesses that you're at. Cover your coughs and sneezes, and if you start having a cough at work, it's a new cough, it's time to go home. The best way that you can be a hero in all of this is not to expose the people around us.
Another question is what's being done with the prisoners to protect them?
Yeah, and we're working with the Department of Corrections. We have had some cases that have occurred within the prison system. We work very closely with those areas to make sure that we provide the best protection possible. It's tough because social distancing is the biggest key, but we want to do what we can to prevent infection in those as well.
There's a question here about mail delivery and the use of the equipment. I think a better way to phrase it may be, how long does the virus stay on the equipment or on the letters that are being delivered as it processes through all the zip codes in America and outside?
Yeah, and we don't have an indication that this virus is being transmitted in that way. We know that the virus can live on surfaces, and certainly, just like we think of things like influenza, that when that virus gets on a hard surface, like even this in front of me, that if you touch it and then rub your eyes or your nose, your mouth, it can be transmitted in that way. The best thing to do is to do those things that we talked about, and that is clean your environmental surfaces around you. Clean them frequently, especially those high-touch areas, things like doorknobs that people touch a whole lot. Clean those often throughout the day. And it can just be with your normal household cleaners that you've been using. But when you clean that, you reduce that risk of transmission. This virus, it's not the hardiest virus that's going to live for weeks outside of somebody. It's more on the matter of hours to just a couple of days, depending on the surface. So this is not a hardy virus that's going to live on an environmental surface for a very long time.
Okay. Doctor, those are the main questions for you. I know you've got a busy schedule. If you want to leave, there are a few questions maybe Speaker Gunn can help us with
I got
here.
a couple. Actually, I have a couple, if it's okay.
Okay.
Absolutely.
Doctor, can you elaborate on why Clinton was chosen for this testing site? People might think it's in response to a possible spike in cases. Can you talk about that?
Yeah, we haven't had a spike in cases, but you know, you don't know until we're doing broad testing. And broad testing is one of the cornerstones of our response in the state, is to make that testing as available as it can. The more cases we find, the more action we can take to prevent further transmission. And you don't know what you don't know. And it's important for us to offer this in many communities as we can. And those plans are in place.
I wanted to ask you about the reasoning behind adding commercial and private lab test numbers to the website. I saw that was a new change today.
We've been working on obtaining those numbers. As you can imagine, we have lots of commercial labs and in some cases hospital labs that are coming online to do testing. We want to be able to capture that information. And so we're going to be updating our website frequently with those numbers. I think it's a good representation of the numbers of folks that are being tested in Mississippi. We want to increase those numbers though.
My last question, we've heard people who were tested are talking about sometimes waiting up to a week to get results. We've also heard of a backlog. What can you tell us about that?
Well, and it depends on where the test is sent, obviously, and it depends on where, what lab the test is sent to. Certainly from a public health laboratory standpoint, we are working to close that time down because you're right. And that's why when you get tested, if you're waiting those couple of days to get your results, that's why we want you to isolate yourself. If there was enough of a suspicion for you to be tested for this coronavirus, there's enough of a suspicion for you to have it, and that's why you need to isolate. Don't assume your results are negative until you hear.
What about the use of masks? What is your recommendation, or do you have any new recommendations?
I think more recommendations about that will become available as we move through this. Certainly one of the things that we've been working on is making those recommendations for masks in the healthcare setting. If you look at nursing homes, for example, one of the things we want to avoid is bringing that virus in the first place. And what the mask can do is it's not going to be as much protection for the person who's wearing the mask from that person. But if I'm ill and I have on a mask, I have now reduced my risk of transmitting it to the people around me. Hope that makes sense. Thank you, sir.
Thank you, Dr. Byers. A follow-up question on why we're doing it here, having the testing here. The city requested it to come here to be part of the solution, and we haven't seen a spike or any other reason except that I felt like every city should be willing to help. These are unemployment questions and what people need to do. So I'll just ask two or three of them here. One lady lost her job prior to the coronavirus, and is there anything that could the Employment Commission are still focused on those people? And then there's a lot of people that seem to be having trouble getting through to the unemployment office. So Speaker Gunn, if you could address that maybe.
Yes, I'd be glad to. Let me make a few comments. First of all, I mentioned a minute ago that I sat down with Jackie Turner last Friday, did a 30-minute interview with her on all of these questions. So I would invite you, first of all, to go to my Facebook page. We answered the most pressing, the most common questions there. She talked about people who are self-employed, people who are independent contractors, people who lost their job because of a layoff, people who just simply experienced, self-employed individuals who just experienced a decline in business. All of those questions are answered during that interview. I will touch on them here again, but before I do, I want to remind you to go to that. There's more that we can talk about here right now in the time limit that we have. There's a 30-minute interview there on my Facebook page. There's also other updates I do every day. I almost touch on unemployment. So I invite you to go there. There's a written version There's a video version, and you can look at both of those and get those answers. Let me tell you 3 things basically that she said that maybe will help you. The most common complaint, Mayor, is we can't get through. We're calling, we're on hold forever. Somebody answers, they hang up on me. I cannot get through. This is simply a result of volume. The number of people who are calling is enormous. I touched on that a second ago. They've seen a 10% increase in claims. Every claim takes about 15 to 20 minutes to process. That's without any problems. As you can imagine, they're taking sensitive information. For that reason, you just can't have anybody working there. They are trying to increase the number of people who are answering those phone lines. As I said a minute ago, they normally have 250 lines. They've gone to 900. They're trying to get more people to work there, but you're dealing with sensitive information, social security numbers, addresses, birthdays. So you just can't pull people in off the street and say, answer this phone and take down the information. So it does take a little bit of time for them to do a background check on the individual, make sure they're not going to come in there and misuse that information. They're doing what they can to try to get more people answering the phones. They've expanded their call hours from 7 in the morning to 10 at night. So some of the things you can do, as I said a minute ago, is call during non-peak hours. Call after 5 o'clock. The number one way to file your claim is over the internet. I think their website, I'm doing this from memory, but I think it is cv19 at mdes.ms.gov. That is CV, which is short for COVID, 19 at mdes.ms.gov. That is their website. Go there, you will find the process for filing your form. They have requested that you start there. That's the number one place to file your claim. If for some reason you can't get through at that email address, then there's a form on there that you can download, a written form. There's a link. You just hit that link, it shows you the form, you fill out the form, and then you need to take it to your WIN Job Center. They have enlisted the help of the WIN Job Centers. Now let me correct what I just said. You don't take it there because they're closed. Keep in mind, they have shut down the WIN Job Centers. But there is an email address and a phone number, both on my Facebook page and on the MDES website, that tells you what the WIN Job Center is in your area. So if you live in Amory, Mississippi, there's a WIN Job Center up there. Look on my Facebook page or look on their website. You will find an email address that you can send that form to. Fill it out, scan it, send it to them, or call the phone number. If you want to file a claim, those are the 2 best ways that they're requesting that you file the claim. Do it over the internet first. Secondly, print out the form, fill it out, and send it in. Thirdly, if you have no success there, then you call the number, and then hopefully somebody will answer and walk you through it. But again, the number one thing you can do to help alleviate long wait times is to not worry about filing your claim today if you can wait. That is the main thing they're trying to remind people is your benefits start from the day you were laid off. So you don't have to file the claim today to hurry up and start. Or if you feel like you're missing out on some money, you're not. They will run your claim from the day you were laid off. You'll still get those funds. But calling them is really kind of the last resort. Try the internet first. Try the printed form with the WIN Job Center. And thirdly, wait if you can. Then fourthly, if you can't wait and you have no success with those others, then call them. Now, had a lot of questions about, I'm self-employed. I've seen a decline in business. Do I qualify? My recollection from her is no, that is not an unemployment situation. I'm an independent contractor. That too may not apply. There are a lot of individual situations that we've been asked about. What I've just described to you is the most common. I would invite everyone who has an individual situation like the one that you asked about that said they lost their job before the coronavirus hit. I don't know the answer to that, but we're willing to find the answer for you. Call my office, 601-359-3300, or email us, COVID-19 questions at house.ms.gov. My staff is working hard to answer what I call all of those individual situations. A lot of different facts. A lot of you have a lot of different situations. We're trying to address those individual things. We're calling her, we're getting answers, calling her staff, we're getting back in touch with you. So if we've not covered your particular situation, use that contact information from my office and we'll try to get the answer. I just mentioned about self-employed individuals, how they don't qualify. I want to remind you, there is help available under the CARES Act. The CARES Act is the federal stimulus plan. So while you may not qualify for unemployment in Mississippi, you may very well qualify for some of the benefits under the CARES Act. We will again help answer your questions and try to assist you with that. So just because you may be self-employed and not eligible for unemployment doesn't mean necessarily that you're not qualified for some benefits that may come down under the CARES Act. Tomorrow on my daily update, I'm going to discuss the unemployment benefits of the CARES Act. Again, I invite you to tune into my Facebook page where we're going to post that information, and it'll also be in written form. So I know I covered a lot there. I hope that kind of gave you an umbrella of all the unemployment claims, but I'll be glad to answer any other questions, Mayor.
A couple of questions maybe I could better answer. It says, what can and will be done to businesses that refuse to adhere to the 6-foot rule? I don't know, that came from a city in the Delta. What I'm doing is the Mayor Clinton is we are sending people by and asking them nicely, and then we send them by a second time and ask them nicely. We had a business in town today that still didn't want to play by the rules, so we sent the police department by to talk to them and not ask them nicely to adhere. So if you didn't have a visit from the police department this morning, I'm not talking to you. Don't worry about that. And finally, we're going to shut you down. I'll come in and shut you down if you're not going to adhere to the rules that we've all set up. Secondly, this question here, the driver's license is expired, the renewal offices are closed. What should you do about driving to the grocery store? I'm going to answer this question delicately. I'm not going to advise you to drive with an expired driver's license, but I think that if your driver's license expired in the last 3 weeks, and an explanation to the police officer would probably, be okay. If your driver's license expired 6 months ago, it's probably a whole different answer. So, you drive if you choose to, but if you do get pulled over, just explain that the driver's license station's closed. Ironically, you asked that. I called over Vicksburg this morning to see if they were open, and they're not. So I understand that. Individual contractors, we did one of these last week on the SBA PPP program. If you'll go to our webpage and look at that, that can answer maybe some of your questions about getting paid or payments or options that are offered to you. Now, one last question was asked again about qualifying for the testing. You have to go online, the C-Spire site, we'll have that on our webpage. Then you must fill out the questionnaire and they will call you back with an appointment. But if you do not have the symptoms, they're not going to bring you in for an appointment. All of the emails and phone numbers that were discussed up here, Mark's been writing down, and we will post those next to this film clip when we put it on our webpage so that you can go there, and if you, for example, have a specific issue for the speaker, then you'll have that email address that you can go to and reach him or his staff for that. Have we had any more questions that have come in? Okay, for those of you who do qualify tomorrow, not tomorrow, Wednesday, I'm sorry. When you qualify Wednesday, the address is going to be 200 Soccer Road. It's Traceway Park. For those of you who live in Clinton, it's on the soccer side, back, where the main offices are. 200 Soccer Road. But first, go to the webpage, the C-Spire webpage, and fill out the form, and then they will call you for an appointment. If you show up with no symptoms, they're going to turn you around. Okay? Clinton Police will be out. We have about 6 officers out there to help direct the line and traffic and that sort of thing. And any other items that come up while they're out there, we'll be willing and glad to address for them. So, Mr. Commissioner, have you got anything you'd like to say?
Thank you. One last, I don't know if it's possible, I'm sorry.
Go ahead.
But Mr. Speaker, you may want to address this. I think the person who had the expired license, I believe it's possible in some circumstances to renew online. So you may know more about that, Mr. Speaker.
Yes, there are some circumstances where you can renew online. I also point out the governor's executive order basically said you have until May 1st. If you have an expired license, they have suspended any punishment for that until May the 1st. So that's part of the executive order. And just to follow up on what the mayor said, what are the symptoms? How do I know if I can be tested or not? The Department of Health has said you must have at least a 100.4, not 104, but 100.4 temperature and chest pain, cough, some sort of respiratory problem. So keep in mind that if you don't have at least a 100.4 temperature yet, and you don't have chest pain or a cough or a respiratory issue, they are likely to say you're not yet qualified. Come back later. So just keep in mind those are the two threshold requirements for being tested. That's all I have, Mayor. Thank you.
Okay. Thank you. We appreciate y'all tuning in and listening. We're going to post this so you can come back and watch it later. If you feel like there was any value to it, you might tag your friends on it. So thank you so very much.